Good morning, everyone. I'm Paul Tavares, Client Manager here at the Sylvia Group, and I would like to thank you all for joining our webinar today on Medicare Enrollment for Individuals. Today's presentation will be given by Julia Jennings, RHU LIA, Vice President of Employee Benefits here at the Sylvia Group. There are just a few housekeeping items to review before we begin. And if you have never been on a webinar before, you will notice a box that opens up on the top of the presentation screen. That screen allows you to type in a question for us. Questions will be addressed at the end of the webinar if they are appropriate for the entire group and if there is enough time available. Questions of a personal nature will be addressed after the webinar via email, or we can contact you. The arrows at the top of the box can also be clicked to shrink that box if you would like it out of the way. We hope that you enjoy this webinar, and I will now hand it over to Julie to begin.
Good morning, everyone, and thank you, Paula, for getting us all set up this morning. Throughout the year, the Sylvia Group presents valuable information to our clients through newsletters, seminars, and webinars like this. So thank goodness today's presentation was scheduled as a webinar, and you can stay dry from the rainstorm and not have to come into our office. The topic today is Medicare enrollment for individuals. Whether you are already on Medicare or you're approaching retirement, or you're just gathering information for your parents and loved ones, we hope that you will find this presentation valuable. We will answer questions if time permits at the end of the program, or feel free to call our office or email us afterwards. So having done the introductions, let's begin. So Medicare can definitely seem confusing and even frightening to some people, but we think that a little education about Medicare goes a long way in helping you make the right decisions at the right time for your own personal needs. So I'd like to start by going over some Medicare basics. Medicare is the name for the health insurance program for people who are age 65 or older, or perhaps are under age 65 and are disabled and receiving Social Security disability for at least 24 months. And this is actually immediately if you are receiving disability due to ALS. And Medicare is also available to anyone who is diagnosed with end-stage renal disease, which is permanent kidney failure. Medicare is administered by two areas of the federal government. One is the Centers for Medicare and Medicaid Services, known as CMS, and it is enrolled through the Social Security Administration or the Railroad Retirement Board. The initial enrollment period for your Medicare coverage starts 3 months before your 65th birthday, includes the month in which you do turn 65 and then the 3 months after you turn 65. So that is your initial window to sign up for Medicare. However, if you're covered by your employer's group health plan and currently employed, you also have what's known as special enrollment period to sign up for Medicare at any time after you're eligible, as long as you or your spouse are working and covered by a group health plan through work. So in other words, if you're still on your employer's plan, you're over age 65, but you, for whatever reasons we might discuss today or that you uncover later, you decide that you want to get onto Medicare, you have your own special enrollment period to sign up. You don't have to wait for open enrollment. You also have an 8-month special enrollment period that starts after your employment retires or after your group health plan ends. So this is an additional, let's say that you are over age 65, you're working, and then at age 66 you decide to retire, you lose your health insurance at that time, then you are in what's called a special enrollment period, and you can sign up for Medicare then. If you, I put a note here that COBRA is not considered current coverage, so if you do terminate employment and you're offered COBRA and you choose COBRA, then you can't sign up for Medicare until that COBRA is ended. So you really have a choice of doing COBRA or Medicare. There's what's called a general enrollment period that applies each and every year. It runs from January 1st to March 31st, and your coverage is commencing on July 1. So these are people that might be known as like late enrollees who don't get onto Medicare and either their initial enrollment period or after termination of employment. And so they're still allowed to get onto the program during an annual special enrollment period, but there will be a higher premium charge for signing up for Medicare late. Here, this is a screenshot actually from the Medicare website, which can be found at www.medicare.gov. There's a lot of information on the website if you like to do your own research online. So I'm showing this as an example of what can be found here, but also it's a good way to look at what steps you need to consider for signing up for Medicare according to the Medicare website. The first thing is that you want to sign up for Medicare, and you have to decide if you want what they call original Medicare, which is Part A and B, or a Medicare Advantage plan. Then you have to decide what you want for prescription drug coverage and whether you want any supplemental coverage. So we're going to go over all of those terms in the next few slides. Let's first look at what Medicare Part A is. So Part A is the hospital insurance. It is something that you are automatically enrolled for, and it doesn't cost anything for most people who have been part of the Social Security wages throughout their life. It covers inpatient hospital stays, skilled nursing facility, hospice care, and some home health care. Every year, the deductibles and copays under Medicare Part A are adjusted based on the cost of living. And for 2016, the deductible for hospitalization under Medicare Part A is $1,260. And that would apply for the first 60 days of what Medicare determines as a benefit period. So if you are hospitalized for a specific illness, then you're going to have that $1,260 due, and that would apply for anywhere from 1 to 60 days. If you were to be in the hospital longer than 60 days, there then becomes a payment that is a daily copayment of $315 that would apply for the next 30 days of hospitalization. It jumps up to $630 a day for what is referred to as lifetime reserve days of 60. And then once you've exhausted all of that, you would be responsible for paying any hospitalization costs on your own. In a skilled nursing care facility, there's also a per day copayment that is required after 20 days in a skilled nursing facility, and that's $157.50 per day. Before you get shocked at all these figures and what it might cost you for Medicare A, I do want to let you know that there are other insurances to help fill those gaps, which we'll be getting to. But let's move on to Medicare Part B, which is also furnished through the federal government. You must elect to take Part B insurance, and there is a premium that is paid. Individuals with higher earnings are required to pay a higher premium, and this is based on what you report on your tax returns, your modified adjusted gross income, and there's a chart of payment for people who exceed certain incomes. When you sign up for Part B, you have an initial wellness visit and annual wellness checkups with your doctor, certain preventative tests, and treatments. The deductible under Part B for 2016 is currently set at $147, and then the plan pays 80%, so you'd be responsible for paying 20% of medically necessary outpatient services, which would include doctor visits, diagnostic tests, physical therapy, etc. The Part B insurance does not cover items such as dental care, routine eye exams, and hearing aids. So I did put an asterisk on this slide because things in the federal government are always in process, and there's actually a provision under Medicare that will require new Medicare beneficiaries to pay a higher premium and have a higher deductible in 2016 unless Congress passes legislation to maintain the current amounts. So lo and behold, just yesterday, the House of Representatives passed a budget deal, a bipartisan budget that would substantially reduce the increase that's expected in Medicare premiums that are supposed to take effect in 2016. So that's good news in that the House has identified this, and it will now go to the Senate for the Senate to make a decision on it. What it means for Medicare beneficiaries is, first of all, 70% of the beneficiaries would not see any change or increase in their cost. With this proposed budget, it would end up being an increase in cost for about 30% of the Medicare beneficiaries. They would pay a higher premium for Part B. The current premium, by the way, is $104.90 per month. So new beneficiaries to Medicare would be paying around $123 a month, and the deductible would also be higher than that $147. The increase would not apply to people who are already on Medicare. The people that it would apply to are those who are new enrollees for 2016, people who are enrolled in Medicare but not receiving Social Security, people who are subject to those higher income adjustments I just mentioned, and lastly, people who are under the dual eligible Medicare, Medicaid, because their premiums are paid by the state. So this is an evolving situation, so I can't tell you exactly what your costs will be, but pay attention to the news, and we will have updates through our usual Sylvia communications to let you know when this is resolved. So now that we've looked at all of these deductibles and coinsurance and out-of-pocket expenses under Medicare Part A and B, you've probably noticed that Medicare is not 100% coverage. And in fact, every year, the amounts that you pay for like those hospital copayments are also tied to an increasing index. So most people do want to have additional coverage, and they purchase Medicare supplement coverage, or what's often called Medigap coverage. And this is supplemental insurance that is provided by private insurance companies, not the government, and it's designed to fill in the gaps in your Medicare Part A and Part B coverage. There is no HMO or PPO network. Any doctor who accepts Medicare is an eligible provider for you to seek treatment from. The supplemental coverage covers, as I said, your Part A and your Part B deductibles, covers those hospital copayments, nursing home copayments, and the 20% coinsurance under your Part B outpatient services. These plans do not, however, cover outpatient prescription drug coverage. You have to purchase that separately. In Massachusetts, there are two standard supplement plans that are offered. One is referred to as the core plan, and one is referred to as the supplemental one. There are about 10 plans that are offered in other states. So if you happen to be looking at your Medicare guide from the U.S. government, you might see a chart with all these other options. They don't apply if you are a resident of Massachusetts. We only have two choices, but the choices are pretty good. So some of you may have heard commercials on television or seen them in newspaper or magazine ads, or even gone to seminars about Medicare Advantage plans. And there's a little bit of confusion about what Medicare Advantage is, but it's another choice for you to consider for your Medicare coverage. Basically, I like to look at it as that instead of having your Part A, Part B Medicare coverage, that you would present that card when you go to the doctors, you actually put that card away and you just give them your Medicare Advantage card. And it works like an HMO plan or PPO, which you may have as an employee under 65, you might be familiar with both HMOs and PPO plans. So it's going to replace the Medicare, everybody who accepts Medicare, large Medicare network, with a much smaller specific network that is an HMO or PPO by an insurance plan. The care is managed and claims are processed by these private insurance plans who are actually receiving compensation from the federal government to take care of your health care needs. So if you choose to go with a Medicare Part C or Medicare Advantage plan, you still need to enroll in Part B. You still need to pay for Part B because, again, the federal government is using that money to help reimburse the insurance plans for providing your health care instead of having the Medicare government pay for it. There are some plans that are advertised as zero premium, which means that you don't pay anything more than your Part B premium. There's no additional cost for those Medicare Advantage plans. However, those plans, if you look at them closely, you will see that there are some pretty significant copays for things like inpatient hospitalization, surgery, outpatient testing, specialist visits, etc. So it's not 100% coverage. And be very careful when you're examining these to make sure that you're not only what your out-of-pocket costs are, but whether your important medical providers are in the network that you're choosing for that Medicare Advantage plan. When you're looking at the Advantage plan, you have an option with some plans of either including your prescription drug coverage or not. Prescription drug coverage, which we're going to get to, is known as Part D coverage. So we can move on to that next. And let's look at prescription drug coverage. Obviously, this is insurance for your medications. You can purchase it as a standalone plan, or it may be part of it might be baked right into your Medicare Advantage plan if you choose that. Although it's mandated that you sign up for a Part D plan, it is not a federal plan like Part A and B. This is really private insurance, but you are required to have it. Some of the prescription drug plans do have an initial deductible that requires you to pay 100% of your prescription costs until the deductible is met. And the maximum deductible that's allowed under a prescription drug plan is set by the federal government, and for 2016, that amount is $360. If you have a deductible and you're currently on a Medicare drug plan, the deductible in 2015 was $320. So it's definitely creeping up. Whatever drug plan that you choose, and there are about 30 of them available in the state of Massachusetts, each plan has a list of eligible drugs, which is referred to as a formulary. And that formulary can differ from one prescription drug plan or another. So it's important to look at the formulary so that you can determine what copayments, restrictions, or pre-authorizations are required for medications that you might be taking. Also, just as I mentioned previously, that Medicare Part B premiums are higher for people who earn higher income. Under the Part D plan, there is also a surcharge that is paid to the federal government if you are a higher income individual. So Part D coverage is very confusing to explain and to understand because there's a lot of different parts of coverage. We refer to the initial coverage phase, the gap coverage, or some people refer to as the donut hole, and then catastrophic coverage. So here you'll see a visual chart of how the expenses are divvied up when you have a prescription drug plan. So the first part of it is if you have a deductible, you're responsible for paying the deductible up front. It could be anywhere from $0 to $360, depending on the plan that you choose. The next area of coverage is referred to as the initial phase. And the chart says you pay 25% of the drugs. A lot of the drug plans are using copays in this area. So depending on whether it's a brand name or a generic, you will have a copayment or co-insurance that applies. So you're paying a small portion of the cost of those prescription drugs until the total cost of drugs in 2016 reaches a cost of $3,310. At that point, you go into what's called the donut hole, and you are responsible for paying 45% of any brand name drugs you take, or 58% of any generic drugs you take. And I'd just like to also note here that if you're currently on a drug plan These figures are increased for 2016, so it's a really good idea to look at your drug plan and your medications and what it might mean for you to have these increased points of payment under the drug plan next year. On the prescription drugs that are brand name, where you're paying 45% of the cost, actually what's happening, and this is part of the Affordable Care Act, is that the prescription drug companies, the manufacturers, are actually responsible for paying the other 55% of the cost of those brand name drugs. So it is by law being covered by the pharmaceutical companies that manufacture your brand name drugs. If you are taking medications that bring you to a total cost of $4,850, then you go into what's called catastrophic coverage. And at this point, your out-of-pocket costs are going to drastically reduce. You will only be paying 5% of the prescription drug costs at that point, depending on how high your medication costs are during the year. But as you can see, it's not something that you would typically see in an insurance plan that you've dealt with before. I don't know who came up with this idea of going from no coverage to some coverage to less coverage to more coverage again, but hopefully this helps you understand that it is a confusing coverage, and that is something that really should be looked at carefully. Since we're talking about all of the parts of Medicare, Part A for hospitalization, B for outpatient services, C, which is your Medicare Advantage, D, which is your prescription drug plan, and then Medicare supplements, which help to fill in the gaps, let's take a moment to look at what Medicare doesn't cover. This is a screenshot from the Medicare website, again, which is www.medicare.gov. And it says that Medicare doesn't cover everything. If you need certain services, you're going to have to pay for them yourself. So if you look at what some of the services and items that Medicare doesn't cover, it includes long-term care and also called custodial care. This is really important to note that other than for a skilled nursing facility, let's say where you're recovering from an accidental injury, such as a broken hip or replacement, or if you have some type of a short-term need, Medicare is going to pay you for that amount of time when you're receiving skilled care. But at any time that your care is considered to be custodial in nature and not requiring the care of medical, like skilled nurses, doctors, etc., then that falls into the custodial care category, and Medicare is not going to cover it. With this month coming up in November, it's National Long-Term Care Awareness Month. It's a really good time for you to consider, if you're looking at your Medicare costs, how you also would want to protect yourself from the financial impact of long-term custodial care that's not going to be covered by Medicare, Medicare Advantage, or any Medicare supplements. We do have experts within the Sylvia Group that can help you with that conversation of long-term care coverage and how to best plan for your needs. Aside from that, Medicare doesn't cover most dental care, eye exams, dentures, cosmetic surgery, hearing aids, routine foot care. Some of the Medicare Advantage plans do offer coverage for, let's say, some limited dental or eye exams. So that's one of the advantages to Medicare Part C, or the Medicare Advantage coverage. I also want to point out on the screen down on the lower right-hand side, it says, is your test item or service covered? This is a great resource for if you're on Medicare and you're not sure how something would be covered. Let's say that you need to go to a physical therapist, or you're diabetic and you need to get insulin and insulin supplies and test strips and so forth. You can type that into the Medicare website and be brought to information about that coverage. So in summary, you need to make some choices for this coming year, or perhaps you're considering what choices you have to make in the future. I just wanted to capture what needs to be done now. If you are currently enrolled and you want to make some changes, this is what's known as open enrollment for 2016. Open enrollment started on October 15th, and it lasts through December 7th of this year. Whatever changes that you make or plans that you enroll in during that time period will be made effective as of January 1st, 2016, and will remain in effect for the entire year. You don't need to make an enrollment change annually if you don't want to make any changes to your Medicare coverage. So in other words, if you're already on Medicare, you're happy with what you have, then you don't need to do anything. You can just go on 2016 just as it is. Chances are you're going to have an increase in the cost of your insurance, whether it's a Medicare Supplement, your prescription drug plan, Medicare Advantage. Most of them are increasing their premiums to differing degrees. Also, I want to caution you that on prescription drug plans, Part D plans, there are fewer plans available. There are more plans with deductibles than non-deductibles, and the formularies of the drug list that that are allowed by Medicare are constantly changing. So if you've had a Medicare plan and your prescription drug needs have changed during the past year, it might be a good idea to look at the Part D plans now and make sure that you're still in the best plan for next year. If you had signed up for a Medicare Advantage plan, but now you're finding that you spend more time outside of the provider network, either because you're traveling south for the winter, or maybe your doctor was affiliated with one office, in the community, and they've moved their affiliation to another hospital group or medical group, you might find that that's affecting your Medicare Advantage access to your doctor. So this is a good time to consider all of these things. You can search for Medicare supplement plans, Advantage plans, and Part D plans on the government website, or you can always give a call to our office. We are your partner in helping you select Medicare coverage for yourself, your family members, if you're involved with an employer group, also for your active and retired employees. So that summarizes what I wanted to share with everyone today. I do think that we have time for questions if there are any questions. And at this time, I'd like to thank you for attending the webinar. We will be posting this presentation on our agency website, and you can contact me with any questions that you have or assistance that you need with your Medicare enrollment by emailing me at the Sylvia Group or by calling our main office. Please note that if you are involved with an employer group and you wish to have more information about the Medicare options that you make available to your employees, we will be hosting another Medicare webinar on November 10th on that topic. Paula, are there any questions at this time?
Hi, Julie. No, I'm just waiting to see if anybody has a question for us. We can certainly stay on the webinar for a few more minutes if anybody would like to post a question. But if, in respect of everyone's time, the webinar has concluded, and if anyone would like to disconnect, you certainly can, but we will stay on for a few more minutes. We'd like to thank you for your time, and please have a wonderful day.
Okay, thank you. Good day, everyone.